She looked at the woman sitting in the waiting area of the Rideau Valley Medical Center and saw an inconvenience. She saw a tired face. She saw dark skin and a worn canvas tote bag, and she made her decision in under 3 seconds. What clinic manager Brenda Colquhoun did not see was the colonel's rank on the woman's service record. She did not see the 31 years of uniform. She did not see the deployment patches from Bosnia, Afghanistan, and Mali, or the meritorious service medal sitting in a velvet box on a shelf in the woman's study. She did not see any of that because she did not look, and that oversight was about to cost her everything she had spent 2 decades building. The waiting room of the Rideau Valley walk-in clinic on a Tuesday morning in late October smelled of antiseptic and burnt coffee. The chairs were the stackable plastic kind, bolted together in rows of 4, and most of them were occupied by people clutching numbered tickets and staring at a wall-mounted screen that cycled through health tip slides nobody read. Colonel Vivian Okafor-Strand, retired, sat in the second row from the back, her coat folded neatly across her knees, her hands resting open on top of it. She was 51 years old, and she had the kind of posture that made a room feel slightly more organized just by her being in it. She was not fidgeting, she was not checking her phone. She was doing what she had done on 4 continents over 3 decades. She was waiting with patience, and she was watching. She had driven down from her daughter's place in Manatik that morning. Her right knee had been locking up again, the old injury from a training accident in Petawawa that had never quite healed the way the surgeons had promised. The walk-in was not her first choice. She had a GP, but Dr. Lafleur was booked until December, and the knee had been waking her up at night. So she had arrived at 7:45, 15 minutes before the doors opened, taken ticket number 3, and found a seat. She had been sitting for 40 minutes when Brenda Colquhoun came out from behind the reception partition. Colquhoun was the clinic manager, though she wore the title the way some people wear a borrowed coat, visibly conscious of it, constantly adjusting. She was somewhere in her mid-40s, with a lanyard heavy with access cards, and a tendency to lower her voice when giving instructions so that the staff had to lean in, which she seemed to enjoy. She had managed the Rideau Valley Clinic for 11 years. In that time she had developed a finely tuned sense, she believed, of who belonged in her waiting room and who was simply using the address. She came out of the partition with a clipboard and scanned the room. Her eyes moved past the retired schoolteacher with the compression socks, past the university student cradling his arm, past the elderly Haitian man who had been there since before Vivienne arrived. They landed on Vivienne and stayed there a half-second longer than they needed to. "Excuse me," Colquhoun said, walking over. Her voice was the kind of careful that is actually quite rude. "Are you here for the clinic?" Vivienne looked up. "I am. Ticket number 3. "Right." Colquhoun tilted her head. "And do you have your health card with you today?" "I presented it at registration when I arrived," Vivienne said. Her voice was even. She had spent 31 years in rooms where losing your composure cost you the argument, and sometimes cost you lives. She was not going to lose it over a clipboard. "Your colleague at the desk scanned it at 7:50. "I see." Colquhoun made a small note. "And your address, your local?" Vivienne held the woman's gaze. "My current address is in Manatik. It's in the system." "It's just that we do prioritize patients who are residents of the immediate service area," Colquhoun said. The words were policy. The tone was something else entirely. "If you're from Manatik, you might find the care more streamlined at a clinic closer to." "I was here before the doors opened," Vivienne said. "I have ticket number 3. 2 people have been seen already. I was told the wait would be under an hour." "Things move at their own pace," Colquhoun said with a small smile that meant the opposite of warmth. "I just want to make sure we're serving everyone appropriately." She said everyone the way people sometimes say it when they mean someone specific. Vivienne did not raise her voice. She did not stand up. She simply looked at Brenda Colquhoun with the same expression she had used on a junior lieutenant in Kandahar, who had tried to tell her that her patrol route was unnecessary. The lieutenant had revised his position within 30 seconds. Colquhoun did not revise her position. She made another note on her clipboard, said she would check on the queue status, and walked back behind the partition. Vivienne watched her go. Her threat assessment moved from yellow to orange. 20 minutes passed. The retired schoolteacher was called in. The university student was called in. The elderly Haitian man was called in. Ticket number 3 was not called. A man who had arrived at 8:30 with ticket number 9 was called. Vivienne stood up. She walked to the reception desk and waited until the young clerk looked up. "I'm Colonel Vivian Okafor-Strand," she said, quietly enough that only the clerk could hear. "I have ticket number 3. I've been waiting for over an hour. I'd like to understand the reason for the delay." The clerk, a young woman with a ponytail and an expression that suggested she had seen this sort of thing before and hated it, typed something into her screen. Her eyes went slightly wide. "I'm so sorry," the clerk said in a lowered voice. "There's a note on your file from the manager. It says, flagged for secondary verification of address eligibility." She looked uncomfortable saying it out loud. I can remove that. It's not a standard code." "Please don't remove it," Vivian said. "Please print it." The clerk looked at her. Vivian nodded once, calmly, and the clerk printed the note without another word. Vivian returned to her seat, folded the printout, and placed it in the front pocket of her tote bag alongside her phone, which she now unlocked. She did not post anything. She did not call anyone in anger. She composed a short, precise email to 3 recipients: the clinic's Regional Health Authority Oversight Officer, the College of Physicians and Surgeons of Ontario's Patient Relations Office, and her personal lawyer, a woman named Therese Aubin, who had once described herself at a dinner party as someone who enjoyed situations where the paperwork is already done for her. Then Vivienne sat back down, crossed her ankles, and waited. She was called in 11 minutes later by a different staff member who could not meet her eyes. The physician who saw her, a young doctor named Dr. Mensah, was thorough, professional, and apologetic in a way that suggested he was aware something had gone wrong in the waiting room before Vivienne arrived at his door. He assessed the knee, ordered an imaging referral, and gave her a note for a specialist. The appointment lasted 22 minutes. Vivienne thanked him and left. Brenda Colquhoun was behind the partition when Vivienne walked past. She did not look up. Vivienne did not stop. She walked out through the glass doors into the grey October morning and sat in her car for a moment, watching the condensation on the windshield bead and run. She was not shaking, she was not crying. She was thinking the same way she used to think before briefings, organizing facts, identifying objectives, determining what resources she had and what the appropriate response was. She had the printed note. She had a timestamped check-in record. She had ticket number 3 and a list of the sequence in which patients had been called. She had the email sent and timestamped before she had been seen. And she had Therese Aubin, who had already replied with 2 words: "Send everything." She put the car in drive and headed north on Riverside. What happened next moved faster than Brenda Colquhoun had ever seen anything move in 11 years of clinic administration. Therese Aubin filed a formal complaint with the Regional Health Authority within 48 hours. The complaint cited the internal note, flagged for secondary verification of address eligibility, as evidence of discriminatory administrative interference with patient access to care. She attached the time-stamped registration record, the ticket sequence log obtained through a Freedom of Information request, and a statutory declaration from the young clerk, who had decided, after a night of thinking about it, that she was not willing to be the person who stayed quiet. The health authority opened an investigation 4 days after the complaint was filed. They did not announce it publicly. They didn't have to. The clinic's own staff did that. One of the nurses who had been working the desk that morning had a sister-in-law who worked in health policy in Ottawa. That sister-in-law mentioned to a journalist she trusted that there was an investigation underway into a walk-in clinic manager who had deliberately delayed a patient's care based on race, and that the patient in question was a retired Canadian Armed Forces colonel with a service record most people in this country would not be able to imagine. The journalist made 2 phone calls to confirm the details, then published. The story ran on a Wednesday afternoon. By Wednesday evening, it had been picked up by 4 national outlets. By Thursday morning, Colonel Vivienne Okafor-Strand's name and Brenda Colquhoun's were in every major newsroom from Halifax to Vancouver. Vivienne did not seek the attention. She gave one interview to a journalist she had worked with years earlier on a piece about women in combat roles, and she was precise and restrained in everything she said. She did not perform outrage. She did not cry on camera. She stated facts, named the date, described what had happened in the waiting room in the same direct language she would have used to brief a commanding officer. "I was there before the building opened," she said. "I had ticket 3. I was not seen until after ticket 9. There was a note placed on my file during that delay. I am not speculating about the reason. The note is in the record." She was asked how she felt. She was quiet for a moment. "I've been in places where people were trying to kill me," she said. "This wasn't that. But the assumption that I didn't belong somewhere, that I needed to be managed, that my presence was a problem to be solved, that's something I've encountered more times than I have in uniform and out. I'm 61 years away from when the Canadian military first allowed women. I'm decades from the first Black Canadians who served. We built things here. That should count." The interviewer did not say anything for a moment after that. The clip ran everywhere. By the end of the week, the regional health authority had suspended Brenda Kolkhoun, with pay pending the outcome of the formal investigation. The authority issued a statement describing the internal note as inconsistent with the standards of equitable patient care and pledging a full review of administrative practices at the clinic. Kolkhoun did not issue a statement. Her lawyer issued one on her behalf, stating that she had acted within her administrative role and that any characterization of her conduct as discriminatory was inaccurate and damaging. The statement did not explain the note. It did not address the ticket sequence. It said very little, in many careful words, and it convinced no one. What convinced people was the note. A 5-word administrative flag, flagged for secondary verification, address, that Kolkhoun had placed on the file of a woman who had deployed to 3 conflict zones, who had commanded hundreds of personnel, who had received a meritorious service medal for her leadership during a humanitarian crisis in Mali in 2009, and whose only offence on the morning of October 22nd had been to sit quietly in a waiting room and hold ticket number 3. Inside the clinic, things moved quickly and badly for Kolkhoun. The clerk who had printed the note provided a full written account to the investigators. 2 other staff members gave statements describing a pattern of behaviour, the way Kolkhoun had a habit of redirecting certain patients, of finding administrative reasons to slow things down, of using phrases like "we want to make sure we're serving everyone appropriately in a way that everyone understood, and nobody had ever felt safe enough to document until now." The investigation expanded. The health authority began reviewing the past 18 months of patient records at the clinic, cross-referencing delay incidents with demographic data. The patterns they found were not ambiguous. Kolkhoun's lawyer advised her to stop speaking entirely. 6 weeks after the morning Vivian Okaforstrand had walked into that waiting room with a bad knee and a canvas tote bag, Brenda Kolkhoun was terminated, not suspended, terminated. 11 years of managing that clinic ended in a letter delivered by HR on a Tuesday morning. She did not go quietly. She filed a wrongful dismissal claim, which her lawyer had advised her was a defensible position. The health authority's legal team responded by entering the full investigation report into the record, all 212 pages of it. The wrongful dismissal claim was withdrawn 3 weeks later. The Professional Association for Health Administrators in Ontario opened their own review of Kolkhoun's conduct. That review concluded in February. Her membership was revoked. Without that membership, her path back into health administration in the province was effectively closed. Vivian was not monitoring all of this closely. She had her life to get back to. The specialist referral came through, and she was booked for imaging in November. The knee, it turned out, would need surgery, a procedure she had been putting off because the waiting room visits had become, in her words to her daughter, an exercise in patience she didn't always have energy for. She was scheduled for January. Her daughter, Zora, who was 31 and worked in environmental law, and had her father's stubborn streak and her mother's way of organizing a room just by walking into it, had been the one to answer the phone when the second journalist called. "My mother is not a symbol," Zora said before putting the journalist through to Vivienne. "She's a person who went to a clinic with a sore knee. That's the part people keep missing." She was right, and it was also the part that landed hardest. Because the comments that came, and there were thousands of them, from Canadians who had seen the interview clip, who had shared it, who had written about it, kept circling back to the same place. Not to Vivienne's rank or her medals or her deployments, to the image of a woman sitting quietly, holding ticket number 3, being made to feel like she had wandered somewhere she didn't belong. What would have happened if she hadn't known her rights? One comment read, with over 4,000 likes, "What happened to everyone before her who didn't have a lawyer on speed dial?" That was the question that mattered. Not whether justice had been served in this particular case. It had in the end, as thoroughly as the system was capable of serving it. But why it required a colonel with 31 years of service and a printout and Thérèse Aubin to make it happen at all. Vivienne thought about that. She mentioned it in the interview, almost in passing, and the clip of that moment spread further than anything else she said. "The system works," she said, "eventually. For me, I had resources that most people don't have. I knew exactly what to ask for and when to stop talking and when to start documenting. Not everyone knows that. Not everyone has what I had in that waiting room. And that's the conversation we should be having. Not about my medals, about the person who doesn't have them." She paused. Because that person was also in the waiting room. They just didn't make the news. On the 1st of March, Vivienne attended the opening of a patient advocacy clinic in East Ottawa, funded in part by a settlement that Thérèse Aubin had quietly negotiated on her behalf with the Regional Health Authority. The clinic offered free navigation services to patients who had experienced barriers to care, help understanding their rights, help filing complaints, help documenting what had happened to them. It was staffed partly by volunteers, partly by a small paid team, and it had a waiting list from its first week of operation. Vivienne sat in the back row at the opening and watched a room full of people who had driven in from Vanier and Gloucester and Orléans and Bar-Haven, people who had stories of their own, people who had not had a printout or a lawyer's email, or 31 years of knowing exactly when to go on record. She did not make a speech. She was not the guest of honour. She had asked specifically not to be. Admiral James Okafor, her brother, retired Royal Canadian Navy, who had driven down from Kingston for the occasion, sat beside her and said nothing for a long time. Then he said, "You could have just taken the knee pain to the emergency room." "Yes," Vivienne said. "You chose not to." "No," she said. "I didn't choose any of this. I just didn't leave when she expected me to." She looked around the room. At the intake desk, a young woman with the same kind of patient expression Vivienne had been wearing in that waiting room 5 months earlier was taking down the name of an elderly Congolese man who did not speak much English. Beside him was his granddaughter, translating quietly, her hand on his arm. Vivienne watched them for a moment. Then she turned back to her brother. "I think we're done here," she said. She meant the opening event. She also meant everything else. Brenda Colquhoun thought a tired-looking woman in a canvas tote bag was someone she could move around a waiting room like an inconvenient chair. She thought her clipboard and her lanyard gave her the authority to decide who deserved care and who could wait. She was wrong, and when you build your authority on that kind of assumption, you don't just lose the argument, you lose the job. You lose the membership, and the building you thought you were protecting closes its doors on you so quietly you barely hear it happen. Vivienne Okafor didn't raise her voice that morning. She didn't need to. She just didn't leave. If this story made you feel something, a quiet anger, a recognition, a sense that this is closer to home than it should be, share it with someone who needs to hear it. Subscribe to Voices of Courage for more stories about people who were underestimated and refused to go along with it, and leave a comment. Have you ever been made to feel like you didn't belong somewhere you had every right to be? We read everyone. I keep thinking about that printed note. 5 words, flagged for secondary verification, address. Brenda Colquhoun typed it in under 10 seconds, probably without thinking too hard about it, the way people do things they've done 100 times before without ever being asked to account for them. And that's the part that stays with me. Not the cruelty of it, exactly, but the casualness. The assumption that there would be no consequence, that the woman in the canvas tote bag would just wait, or leave, or simply absorb the message and not push back. She pushed back, quietly, without drama, without raising her voice once. She asked for a printout, she sent an email. She documented what she saw, the way someone does when they've spent decades in rooms where the truth only holds if you can prove it. That's not luck. That's something built over a long time, a kind of clarity about what you're owed and what it costs to walk away without saying so. I think about what Vivienne's daughter Zora said, that her mother isn't a symbol, that she's a person who went to a clinic with a sore knee. That's the sentence I come back to most because it cuts through everything else. Vivienne didn't walk into that waiting room as a colonel. She walked in as a patient, a person in discomfort asking for help. And someone looked at her and decided before she had spoken a single word that she was a problem to be managed rather than a person to be served. What undid Brenda Colquhoun wasn't the complaint itself. It was the pattern behind it. The investigation didn't find one bad morning. It found 18 months of the same behavior, documented in records she thought no one would ever look at carefully. The thing about using your position to make people feel small is that it leaves a trail. Every delay, every redirected patient, every administrative flag, it all accumulates. And when someone finally goes on record, the whole structure comes down at once. That's how I understand what happened here. Not as punishment handed down from somewhere outside, but as consequence that was always attached to the action, waiting to be made visible. Colquhoun built 11 years of authority on a foundation that required people to say nothing. One person chose not to say nothing, and the whole thing followed from that. What I take from Vivienne's story isn't really about rank or service records or medals. It's about knowing what you're entitled to and being willing to say so clearly, in writing, in the moment, without letting anger make it messy. It's about having the kind of discipline that doesn't collapse under pressure. And it's about using whatever you've built, whatever knowledge, whatever standing, whatever access you've earned, not just for yourself, but to open a door for the people who come after you who don't have what you have. The patient advocacy clinic that opened on the 1st of March is still running. The elderly man at the intake desk on opening day, the one whose granddaughter was translating quietly beside him, he got the referral he'd been trying to get for 4 months. That happened because Vivian Okafor Strand asked for a printout instead of just going home.